Hello, I'm Marc Gorelick, Children's Minnesota President and CEO. First and foremost, I hope you and your loved ones are staying safe and healthy in the face of this coronavirus pandemic that has affected so many here in Minnesota and across the nation and the world. COVID-19 is impacting all of us, and Children's Minnesota is no exception. As the major nonprofit independent pediatric health system in the state, Children's Minnesota is being profoundly impacted, but perhaps not in the ways you think. We here in Minnesota, thanks to early and aggressive steps to promote social distancing, have done a great job of mitigating this disease and flattening the curve. Things like school closures and staying at home have slowed the spread of COVID-19 and a host of other illnesses as well. We've also come together as a healthcare community to conserve resources, especially personal protective equipment such as masks, gowns, and gloves, as well as certain medications that have been in very short supply due to disruptions in the global supply chain and worldwide increased demand. The way we have done this is by delaying non-urgent procedures and visits that can wait. All of this has led to a sharp reduction in volumes and activity, and therefore revenue, in nearly every part of our health system. And the fact is that while children can get COVID-19, they are less likely to get sick and much less likely to need hospitalization, which of course is great news for kids. Even in the face of this unprecedented situation, Children's Minnesota is rising to the occasion as a healthcare leader. We continue to care for hundreds of hospitalized children each day for everything from cancer treatment to heart transplants to neonatal care. And as always, no child is ever turned away, regardless of their ability to pay for care. So what are we doing to deal with this pandemic? First and foremost, we're prioritizing the health, safety, and well-being of patients and staff by employing strict visitor guidelines, increased illness screening for visitors and staff, and policies calling for patient-facing staff and visitors to wear masks. On the outpatient side, we're minimizing exposure by dividing clinic visits between sick and well children. While in the hospital, we've added negative airflow rooms and developed a process for ultraviolet light disinfection. We've also added the in-house ability to perform a rapid test for the COVID-19 virus with the capability to perform up to 50 tests a day, getting results within 1 hour. And in response to constraints on in-person visits, we've rapidly expanded our telehealth offerings, more than doubling the number of service lines offering virtual care and increasing the number of virtual visits by more than 50-fold. In terms of responding to the effect of the pandemic on the institution, in response to our considerable financial challenges, we will also be implementing a number of cost-saving measures within the next several weeks, as have all the other health systems in the state. These will involve cuts in discretionary spending, postponement of capital and other strategic spending, and creating operational efficiencies in low-volume clinical areas, including the temporary consolidation of routine medical and surgical inpatients to the Minneapolis campus. It will also include some employee-related actions, such as tiered wage reductions and a short-term furlough of low-need employees. I want you to know we are using principles of fairness, compassion, and equity to guide our decision-making during this difficult time, and we're collaborating closely with the labor unions to determine the best solutions for various employee groups. We're also working on what comes next as COVID-19 patient volumes continue to climb in Minnesota. While most who are hospitalized with COVID-19 are adults, there is a clear need to advocate for children and Children's Minnesota to differentiate us from the adult healthcare systems and make sure the needs of kids are not overlooked. It has become more clear to me than ever the key role Children's Minnesota plays as the voice of children in the state. We are having regular updates with elected officials, key policymakers, and healthcare leaders across the state to ensure we're in alignment and making smart decisions to benefit the community, while at the same time advocating for the unique needs of children within the larger healthcare system. While COVID-19 might have less of a direct impact on kids, they are significantly affected in many ways. Children's Minnesota experts in infection prevention, epidemiology, psychology, child life, primary care, and more are actively providing guidance and vital information to parents, media, community leaders, and others about preventing the virus, about how to care for a child with symptoms of COVID-19, how to talk with kids about the crisis, and how to keep kids physically and emotionally well during this stressful time. I invite you to visit our website, childrensmn.org, and follow us on social media to find helpful resources for you and your family. Thank you for your continued support of Children's Minnesota. Now more than ever, we need community members like you to help provide much-needed stability, support, and resources for Children's Minnesota and the thousands of patients who rely on our care now and in the future. So from the bottom of my heart, thank you for being there for us and with us during this time of great need.